you so much for being here early in the morning. I will remind at the end as well, but just as a reminder, if your name is coming up where we can't identify who you are, can you please either just say your name out loud or put your name in chat? And that way we can put you on the list of participants when we send out the sessionals. Thank you. It's going to be a pretty quick one today, but a couple of important dates. I wanted to start with a land acknowledgement, and I'm fortunate to come to you from the unceded and traditional territories of the Tsleil-Waututh, Squamish, and Musqueam nations, for which I am privileged to live, work, and play. And I did want to acknowledge that we had a capacity issue with our last Dine and Learn. So my deepest apologies for those who weren't able to get in on January 5th. We are looking to rectify our Zoom account and so that we don't have that maximum again. I did want to apologize for that. I'm going to quickly go through a couple of updates. I have been scouring the FAQs on a daily basis, and I have a couple of screenshots I wanted to share with you to just clarify one of the things that was a bit of confusion from last time. I'm just going to launch right into it. So I think we've gone over the new payment model, the 3 time components, the components, the time, the encounters, and the patient panel. So I'm not going to go over that again. I think we've kind of gone over that quite a bit. They did provide an updated physician pathway. Everyone should have got that in their emails, but I just wanted to point out a couple of things here. There's been some questions about the MSP facility number. For those of you who've received a business cost premium, you already have a facility number, and that should be probably almost every one of you. However, the pathway does have an online application, and if you're not sure, you can look at that application. It's got contact information, and you can make sure that you've got your facility number in time. So I'm pretty confident you all have one already. And a couple of dates they put on here, January 24th and 26th. I have a screenshot with the registration on here, but those are the information sessions that they're putting out. They hopefully will have a whole bunch of detail. So those are important dates. They did mention a capacity issue, so make sure to register as quick as possible. Hopefully you all got that email. They have a goal to get the payment and the payment schedule and the supporting information to you by January 20th. That is tomorrow. And so we'll keep a heads up for tomorrow and see what kind of information comes out to you. And we do have another rapid fire January 26th, Thursday, in which we'll have a whole bunch more detail, I'm sure. So we should be looking out for a whole bunch tomorrow, fingers crossed. You will have received this, January 24th and 26th are webinars for information sessions online for physicians only. I've put in the PowerPoint, the registration links in here, and we'll send out the slides, but you should have the email. So please make sure that you try to get registered in case there is any capacity issue. We will be attending as well. We have our physician working groups attending, so we'll get all the information regardless, and we'll share it out to you. There were a couple of FAQs that I went through and wanted to clarify because there was a bit of confusion, or I had a bit of confusion based on a couple of different questions we had last time. So I put a few FAQs here. One was, how does it work for the physicians who provide both longitudinal family medicine care and also episodic care at a different location? It says, while some family physicians who meet the eligibility provide episodic care, if those services are provided at a different location, perhaps you work at a walk-in clinic as well as your regular practice, those services cannot be billed under the new payment model. That physician would continue to bill those ones under the current compensation model, which is fee-for-service or your alternate payment program. So if you're working in multi-location, you have a main office where you're doing the LFP payment model. And then if you work in a walk-in clinic, you continue to bill fee-for-service. Likewise, there was questions about whether you'll continue to receive the CLFP payment. And that payment is meant for people on fee-for-service. So if you move to the new model, you will not be getting the CLFP payment. So I just wanted to make that clear. Instead, physicians being paid under the new model will receive a panel payment based on your number of active patients and complexity of those patients. Can I bill under the LFP model when providing care to patients of other family physicians in my clinic? So that's within your clinic. And it says that the physicians that work together, the cross coverage, those physicians who meet the eligibility and provide their colleagues' patients with those services can be billed under the new model using the new time and encounter codes. The physicians will just not receive a panel payment for those patients that are not attached to their own practice. So that's within the clinic. While we recognize that I'm getting good at having sessions where I'm not really giving you any information, I think I should go into politics. We are getting a lot of questions around clinic splits. What's the new split? What are clinics doing? All sorts of very specific scenarios about your setup or whether you're co-sharing a panel and things like that. We're not entirely sure the guidance that's going to be coming out from Doctors of BC or BC Family Doctors. So what we really wanted to do is take a check from everybody what it is that you think you might need from us. I'll put a disclaimer out there that the division may not have a role in guidance around splits and overheads and negotiating. It is clear that you need to negotiate with your clinic about these things, but for clinic owners, we're wondering what do you need to figure these things out? For physicians who work with colleagues in clinics, what do you need to figure these things out? And for locums, how will that look? We don't have information yet on the locum payment, though we have been told that should come out after February 5th sometime. But, you know, if there's an opportunity to host conversations or discussions for each of these different sets, clinic owners, physicians, locums, if there's any group that we've missed, we'd love for you to put in chat your concerns, your questions. If you've already figured something out and you'd like to share that, we would love to know that. And if you have any topics or ideas that you think that we could provide, we can look to see if we can do that through the division. But we would need to know what it is your concerns are around these questions that are coming up so that we can potentially facilitate something or host discussions. If you have any ideas of how we can work through this information and perhaps come up with maybe North Shore consensus on some of these things, we would really like to hear that. But mostly the the two big things today are making sure that you attend those information sessions, 24th and 26th, that you have a heads up for looking out for the information that should be coming out hopefully tomorrow. That is their goal. And another mention is chronic disease management and some other billings that will no longer be effective after February 1st if you switch. We are fairly confident that you'll still be able to bill back 90 days. However, I do encourage you to reach out to us if you're not sure of your incentive fees for CDM and such that are due or overdue. Want to make sure that we are billing all of those because you've done the work already. Like I said, I think we'll be able to bill back the 90 days that we've always been able to do. So we wanted to kind of just generate some ideas for conversation that we potentially could host. We'll bring that back to the group and see if there's anything that we can provide to give some more guidance or at least a space to have discussion and come to some consensus or ideas around how to deal with this. So though I'm assuming you'll put a bunch of different questions and concerns in chat, I won't be able to answer them today, but it is recorded. And we'll take that back to the team and see what it is that we can do. So if you have ideas or questions, please either put them in chat. My email address is at the end of the PowerPoint. So throughout the next couple of days or weeks, please just fire off any emails with questions, ideas, topics, concerns, and we'll collate that and see if there's things that we could do about it on our end. I really appreciate that. And a couple of different things I wanted to mention. The PCN Preventative Care Working Group is looking for a few physicians to join. And it's not a very big time ask. I think they meet for an hour and a half every 4 to 6 weeks for the next little bit. And yeah, it's really interesting work to figure out how we address and move forward with some preventative care on the North Shore. And then I'm going to pass it over to Mary Lou. There's some PharmaNet updates around enrollment for physicians and staff. Mary Lou, did you want to give a quick update on that?
Sure. Thanks, Candice. Hi, everyone. I wanted to ask you to check your business license, because if you have PharmaNet and your business license recently expired, you may not have any more access to PharmaNet until we upload the new business license. You can probably do that directly, but I'm here to help you. If you want me to upload your business license, I just need your authorization and the new business license, and I can help you with that. If you still don't have CareConnect or PharmaNet, or you want your staff to have CareConnect and PharmaNet, please let me know and I'll connect with them directly. That's basically
fantastic. Thank you, Mary Lou. And I see that there are some things being shared in the chat, so I will definitely share that out with everybody. So keep the information coming and the questions coming.
And anyone that is still not identifiable, I have like 3 iPhones, a family. I can't pay such attention to iPhones and family, so please send me your name or just unmute yourself and let us know so that we can add you to the list. Thank you.
And upcoming events. So as I mentioned, there should be a lot of information coming out tomorrow and or Monday. So we will have a January 6th rapid fire where we are hopeful that we will have a whole load of information about the actual detail about service codes, potentially about the additional codes that we don't know about. So we know about the $25 one, but what about procedures and the process, the portal code, all that kind of stuff. We are very hopeful to hear about that tomorrow. January 19th, tonight is a Pathways webinar, 6:30. It's around care pathways, getting the most out of favoriting, callback feature, patient fillable web forms, and more. The PCN is going to provide a session February 16th with Foundry about services, eligibility, and accessibility. And that invitation will go out shortly. And then we've got our MOA course for emergency first aid and CPR, February 25th. I did hear last time there were a few physicians interested in CPR as well. So we will build that into our fiscal plan. So thank you for putting that in there. And I think that is it for today. So really the takeaways tomorrow is that we should have a whole lot more information coming. I did want to clarify a couple of those FAQs, and we really want to hear from you, regardless of your role, clinic owner, locum, what have you, around your own concerns, your own specific cases, discussions you might like to have with others that we can facilitate, and where divisions might be able to help, considering we're not sure where the guidance is going to come from yet around those kinds of questions. So short and sweet today. Thank you for attending. I will leave this open for another few minutes if you want to put more questions in chat or unmute yourself if you have questions. And there you have it. Not a ton of information today, but thank you for attending. And as always, we just want to make sure that you're heard, and that you know that we're here to keep bringing information to you, to keep working through all of the workflow things that you're going to have to support, that we are doing a lot of support for your MOAs. We've had a couple of MOA sessions now on the clinic impact on the workflow, such as your EMR and what they currently do as their job and how they bill and things like that. So we just want to really, the main takeaway is that we're here and we'll keep providing information and support to you through this whole transition. So thank you very much for attending. And yeah, any other questions, please do put them in chat. Here's my email address. So if you think of some things later on in the day or this weekend, please feel free to email them to me. We'll bring them to the working group and we'll see what we can do to address all your concerns. If you'd like to have specific discussions, perhaps with specific groups, perhaps we can facilitate that. So thank you very much. for attending. Hope you have a great day, and we will be bringing more to you soon. Thank you so much, everyone. Nice short one today.